Hi there, hi there, hi there, hi there. Welcome to Specialists in Rehab Medicine. We are going Facebook Live today. We've been asked, as we've been posting things on our website, to actually do Facebook Live with an acupuncture treatment so we can talk about what acupuncture is and how we do it and for what reasons. With me today we have Jennifer. Jennifer has graciously agreed to do this. She's actually been a model for some of our other talks we've given on acupuncture before. So again, Jennifer, thank you for coming in. So as we do this, Jennifer, what condition do you do acupuncture? Do you have acupuncture done for?
I have it done for migraine headaches.
And we've done acupuncture for you intermittently for a couple years. What's been your experience?
After the treatment, I have a lot of relaxation, almost a complete feeling of relaxation.
Go ahead. And your headaches, do you get relief of pain and things
Yes.
like that? Okay.
Yes.
All right. And the one question that everybody wants to know is, does the acupuncture hurt?
No, acupuncture does not hurt. The needles are so superficially placed that you actually don't feel it.
Okay. Some people do, feel
Right.
it, but in Jennifer's experience. So anyway, what we're going to do is I'm going to do a treatment. And so with acupuncture, what we do is we put needles in different areas of the body. And with Jennifer, she's getting treatment for migraines and for headaches. So you would think we would do a lot of the needles into the head, but that's only part of the treatment, and I'll explain to you why in a moment. I also have someone here who's not done acupuncture before. This is Dr. Bach, who's a resident spending time with us, and you've not had acupuncture treatment before.
No.
No, give me your hand, and I'm just gonna do one for you. What did you think of that?
Didn't feel a thing.
Didn't feel a thing, okay. All right, I'll take that out. Thank you for your volunteering effort. Dr. Bach is a third-year resident at the Rehab Institute of Medicine downtown in physical medicine. And let's just start going here. These are disposable needles that we use. We don't reuse them. There are reusables that can be done. They need to be constantly be sharpened and autoclaved, and we said, you know what, it makes no sense, so we just use disposable ones. So far I'm killing you?
So far, so good.
Oh, okay, good, good. Glad to hear that. I don't want you having too much discomfort. So this is a traditional treatment that we do for people with migraines. Every condition and based on every individual is different. But there's certain treatment patterns and parameters we do for different conditions. Let's see, 1, 2, 3, 4, 5, 6, 7, 8. Once the needles are left in, basically we let someone just hang out or relax for usually 20 minutes, depending on the treatment. If we do smoking cessation, that's a 30-minute treatment every time. Certain treatments are a little less for 10 minutes. Just depends on people's response. And then I'm coming back here and I'm putting some in the muscles into the back, by the back of the neck, and if you guys want to come around and take a look at where we're going over here. Don't trip, please. Put a couple on the head, and then that's it. And then we set our timer for 20 minutes. And though usually Jennifer gets to kind of hang out and quiet, she's not getting that today. She's getting a room full of people and everybody kind of talking. So acupuncture, you know what, Andrew, In our room 3, the EMG machine room, we have a acupuncture model. If you can bring that over, I'd appreciate that. So I'll explain to you what that is. Let me tell you about my training with acupuncture. In 1995, I went out to UCLA and trained for 6 months. It wasn't constantly being in 6 months, but it was over a 6-month period at UCLA. It was called the Helms Institute. And we learned what's called the French energetics treatment approach. There's multiple different kinds. There's the traditional Chinese acupuncture, which is a lot more of the use of herbal supplements in addition to the needles, but it's more herbal supplements, whereas the French energetics is more of the needles, and it's going about balancing the energy from people, their living energy that's in each of us. It's thought that under the Chinese philosophy and Eastern philosophy that there is life energy or qi that flows in our body, and that qi flows yin up and yang down in the body and constantly cycling, and it goes through meridians or channels in the body, and we can see this acupuncture gentleman where the different channels are, and that at each of these areas within the meridians or channels there are acupuncture points, which is where we put the needles. Now, when I went to Wayne Medical School, we dissected cadavers, or dead human bodies, and I never saw a meridian and I never saw acupuncture points. But even though we know that they're not there when we dissect a body, nonetheless, this is more towards an Eastern approach of what the Eastern philosophy is, and that we know that it certainly works. If we forward ahead to the 1960s and 1970s, Janet Travell, who was John F. Kennedy's physician who treated him for his chronic neck pain, she outlined what we call myofascial points or myofascial trigger points. Myofascia, myo is the muscle, and fascia is the connective tissue, and she diagrammed trigger points. Now, she didn't know anything about acupuncture, but when they took her trigger points and laid them over an acupuncture diagram, they actually were exactly the same points. So we know that there is some Western approach to this that kind of merges with the Eastern approach. If we look at how acupuncture came about into the United States, it really wasn't done at all. And then in 1972 or 3, when Nixon went to China and had the meetings in China, one of the New York Times reporters, or Washington Post, anyway, one of the reporters that were with him in the entourage came down with an acute appendicitis. And he woke up from the surgery in China with severe pain and said, I'm having pain, and they brought over the anesthesiologist who took a few acupuncture needles and put them in, and he had complete resolution of his pain without opioids, without any pain medication. He then came back and wrote an op-ed piece in the paper, again, New York Times or Washington Post, and then it started getting some traction here in the United States, where it started being done by people, and then physicians started to get involved. And Joe Helms, who is out of in California again, whose training I went to, has trained most of the physicians in the United States with comprehensive courses. There are some weekend courses that some physicians go to, but they're really not comprehensive in terms of courses and coursework and the amount of time it takes to do this. But acupuncture here is about, we do about 5 or 6 treatments a week. It's just part of our general practice of where we take care of people with varied musculoskeletal issue problems, neck pain, back pain, joint problems, and things like that. And so we just use this as another way to help people with their pain. I know you're trying to relax and as you're getting the treatment. What do you feel during a treatment?
Right after I get the needles inserted, I try to clear my mind and kind of wait for the relaxation feeling to come on, and it's coming on about right now.
And again, you said that the needles don't hurt. But it's not an uncomfortable treatment for you and where these needles are.
Not at all.
Okay.
Not at all. You know, at the beginning, I was a little bit skeptical when you suggested it, and I thought, you know, what the heck? I needed some kind of relief, and I was really at the point where I would try it almost anything. And I remember going home and thinking, well, that was interesting, and then having the feeling of relaxation just kind of hit me, and I thought, wow, this is what it's all about. And so from that point on, you know, I bought into it completely. So.
And you've been on different medications. You've had Botox. Was that my phone? I thought we turned it off.
I thought you did too.
Okay. You've had Botox done, and you know, even the prophylactic medications, the Topamax and things like that, nothing has really been, you know, giving you significant relief. And so, you know, in terms of our practice, we, as I said, we do this a part of everything else, but we do treat a, you know, varied mix of problems, neck pain and back pain and things like that. You know, certainly, who people are out there, if you have any questions, by all means, we can, you know, address them.
So we do have some questions coming in. One question from a viewer is, how often can you get acupuncture?
Well, it depends on the different treatments, what it is. For people with smoking, when we do people for smoking cessation, they get it twice a week for 2 weeks, and then it gets spread out. But usually people come in anywhere from once a week. I have a few people who come in twice a week, but it's once or twice a week. Again, more once a week, and then we try to spread it out as much as possible, because I like people to be independent on their own, on feeling good, and not dependent on something, a treatment we're providing.
Thank you. Next question is, how long after you start acupuncture before you start noticing improvement?
Well, it's very variable. What we say to people when we're going to initiate an acupuncture treatment is, you know, give it 3 times to 4 times. If we like to see people at least get some kind of change, whether it's positive or negative, after an acupuncture treatment. If they're not getting a positive response and they're getting a negative response, then we just try to change on how we're doing the acupuncture, because maybe we're putting too much energy in and we need to take more energy out of the system. So change, either good or bad, at least on the first 2 treatments, we're looking for, and then once we fine tune it, then we're looking for continued improvement. But usually if people are saying, I don't feel anything, and it's been 3, 4 treatments, then I don't think it's something that's going to work or worthwhile, so we move on and try other things. For some people, depending on what the treatment we're doing, we will hook up a electrical stimulator, and this actually gets hooked up and attached to the needles by these little alligator clips. And then this, by doing these, this can either, oh, someone left it on from the other day, okay. This can either add energy to the system or take energy out of the system, because as we talk about, everybody has a chi or living energy that's flowing through them, through these channels or meridians. And certain problems that people have is due to an over energy system or an under energy system. So by doing different things with the electrical stimulation, we can add energy or take some away. Another thing we can do is heat up the needles, and I used to do this. There's not a weed, a plant called mugwort, and not hogwarts, nothing to do with Harry, but it's called mugwort, and you light it, and it's called moxibustion, where you put it over the needles and you heat the needles up to add energy into the system. When we used to do this, we used to use needles that were 100% metal and not plastic on the end. Certainly if we did these with plastic, they would probably melt. The problem is it smells a lot like marijuana, and people would come into the office and wonder what we were doing in the office and who we were allowed smoking. plus I would get a significant headache, so that was a deal breaker on both ends. So that's why we stopped using that, and we just go towards the electrical stimulation.
Another question that came in is what types of diagnosis can acupuncture treat?
Well, when I went to training, there were 2 tracks to train. Training that I did was all on pain syndromes, so I learned all about, musculoskeletal pain, back pain, neck pain, muscular pain, arthritis in the knee, and headaches. Those are the conditions that we treat here most oftenly. I also do smoking cessation. There are others who do acupuncture for general medical problems, abdominal pain or, gas or nausea, vomiting, shortness of breath. There's all these kinds of things there are known treatment patterns for. We just don't do them in our office. There also, another question came up from Jessica, was what about pregnant women? We've done a lot over the years with pregnant women with hyperemesis gravidarum, which is women who get a lot of extreme nausea and vomiting, and they can't hold anything down, especially early in pregnancy. I've actually gone into the hospital at Huron Valley and done acupuncture treatment for women on the labor and delivery area there, for women who just can't hold any food down. I've also done it in the intensive care unit for different people with nausea problems, and it's been effective. So, it's still considered alternative medicine, yet the hospitals are recognizing it, and I get called to go in to the hospitals to do those treatments. Yes.
In regards to pregnancy, there have been articles stating that if you do acupuncture when they're near their due date, it will induce labor. Is this true or false?
Well, I know of other ways that are reported to induce labor. I've just not been aware of acupuncture doing that, so I can't comment on that. And any other questions so far? Okay. In our experience and over the years, I learned to do acupuncture 1995, so coming up on 23 years ago. I think it holds a nice place for us, because when we're dealing with people with pain, being eclectic or trying a lot of different things are what's most important. And I try not to be very, in a box and say, I can only do this, I can only do that. So, whether or not, I send people to chiropractors, our practice does. We send people to osteopathic physicians for osteopathic manual medicine. We do acupuncture. We have people go to Tai Chi, and we have people do biofeedback. We have people, see counselors, whatever need, and relaxation techniques. So whatever needs to be done for that individual patient is what becomes most important and what we try to do. So Andrew, in your experience as a resident, have you had a lot of experience, or any other the people you've trained with done acupuncture, or not really?
Not really, no.
Not really. So it's not done by that many physicians. There are some who do. It's also done by people who are accredited acupuncturists who are not physicians, and they go through the Chinese acupuncture programs. And there are different people in the area who do that. In the Detroit area, there's a handful of physicians who do it and do it as part of their practice. I'm the only one in our group who does it, but when they have the need, they will send people to me, just like there are other things that different people do in our practice that they specialize in. I will then send them patients for those kinds of treatments. And there, I just think that it's a nice adjunct to doing these kinds of things. Talking about different kinds of things that we offer in our practice. We have specialty trained physicians in sports medicine. We have people who do pelvic floor dysfunction. and helping women who are either having pelvic floor problems or women in pregnancy. We are adding a physician coming up in October that will be adding some interventional component to our practice. We do EMGs, and I know Dr. Roth a couple weeks ago showed what it was like to have an EMG done on another one of these type broadcasts that you can see on our website at sirmpc.com.
I do have a question coming in over here. Says, my wife has had an MRI on her lower back that showed nothing but still has some pain. What could she do to ease her pain?
Well, one of the things that happens is that when someone has back pain, they expect the imaging is going to show what the problem was. And more often than not, the MRI rather, more often than not, the MRI does not show truly what the problem is, whether or not it's just soft tissue, whether or not it's biomechanical. There's so many other things to do more so than just treat an MRI. So, evaluating someone like that and saying maybe physical therapy, maybe some topical medications, maybe even acupuncture is something that we can certainly, address and see what we can do to help out.
How long have the needles been in now?
Well, that's a good question, because most of the time we set the timer, and the timer is here, and as we can, I did set it. So we have 3 minutes left. It's been 17 minutes, because with this going on, I thought I forgot to hit the button. So we have 3 minutes left for her treatment. The things after an acupuncture treatment that people are not supposed to do is heavy exercise, eating ice cream, eating bamboo shoots or sexual activity for 8 hours. And why are you looking at kind of a face like that?
I don't know. I just
Okay.
never heard that.
Well,
very
I haven't told you, I
interesting
tell
list.
the patients. And the list is like this. If you think about this as exercise, sexual activity and exercise, any exercise, they want you to kind of chill out a little bit. The sweets or the sugar for ice cream is they don't want you sugar loading. And the bamboo shoots, couldn't tell you. That was never explained to me, but and that's what they have done traditionally in China, and then it was brought over to what we recommend to people in the United States. So, but there was a good question about the time. I was like, oh my God, I knew I forgot to start for the timer. And again, the problem for this young lady today is that she's not able to just kind of chill out and get a dark room and close her eyes. She's had to listen to me drone on and on about this.
Another question just came in. A viewer would like to know, does insurance cover acupuncture?
Some Blue Cross policies do. It's really on a policy-to-policy basis. Medicare, Medicaid, your government, healthcare policies don't. So just make a phone call to your insurance company.
You want a holistic rider. That's key to insurance. A holistic rider.
Okay, you want a holistic rider,
Mm-hmm.
like a flow rider, maybe that's different. But a holistic rider on your policy,
On your policy,
to
yeah.
cover those kinds of treatments.
Yep.
Okay, because we're treating 2 people right now with Blue Cross, which is very unusual. We usually don't get that. We usually get just people who private pay.
Right.
And the charge for acupuncture is no different than an office visit, which is $75 for a treatment.
And how are you feeling, Jennifer?
Very relaxed.
Good.
How are you feeling?
Good.
Are you feeling relaxed?
Yeah.
Everybody who's in the room is feeling relaxed just from being in the same room. Have you ever had an acupuncture needle put in? Oh, before you leave today, we can certainly. Would Andrew? Why don't you hold Nisa's camera for a second so Nisa can get one of the pokes. Don't pass out on me.
Not bad at all.
Not bad at all. Jessica, you've had one.
I have.
Christine has too. Every time I try to have you do it, you usually say no. But now that we have you on camera, hard to say
He's
no.
forcing me, folks.
Oh no. So what we'll do now is we'll take out these, And I usually take them out in reverse order, just so I remember which ones and how many. There's nothing worse than someone going home with an acupuncture needle. Though if you do have one at home, you can put it in your plant. Plants do really well if you put them in really underneath of where the first set of leaves come off. It really works well for people without a green thumb. You can add the blue needle and kind of works well. And there is no bleeding, and I don't know if you noticed that I did not wipe down the skin with alcohol, and the reason is because these needles are so fine that oh my goodness, this is the first time I've ever done with you that you've had a drop of blood. It has never happened before.
On that cart in the next room, there should be some Band-Aids.
Oh my goodness. Very unusual. That's because we're watching it live on Facebook. So we'll dab this up, and then we'll ask Jennifer any final words as we get our, wow, it's kind of a big Band-Aid for a small area, but we'll see what we can do. All right, Jennifer, any final words of what you want to share with people now that I made you bleed?
It's just a very relaxing treatment. Today was ideal because it's raining out, and typically my head becomes very the pressure in the front becomes very uncomfortable. So this was a good day.
Perfect. Thank you so much. We appreciate it. And if anybody out there has more questions when we're done, you can certainly call us at our office at 248-360-8660. Thanks for tuning in.